Hello and welcome. I'm Dr. Jack, and for this video we will be taking a deeper dive on a class of medications called Benzodiazepines. It's a class of medications that I have quite a bit of experience with and go over those experiences as well as cover topics like how it works, why it works, when it's indicated, how to take it appropriately, and also talk about my concerns about this class of medication as well. Without further ado, let's jump into the details. My reason for wanting to do this video is that historically we have identified and talked about the growing opiate epidemic that occurs. It's led to a lot of changes. It's led to open discussions about it as well as more responsible prescribing, and also has raised patients' awareness about that class of medications as well. And so there's one class of medications, and that's the benzodiazepines, that I think warrants just as much of a discussion as well as education and awareness because of the dangers of this medication and what I'm seeing clinically. This is a class of medications that we are seeing with increasing frequency in the major news media because so many people, especially famous people, are overdosing on this drug or having bad outcomes. One that immediately comes to mind is Chris Cornell, lead singer for the bands Soundgarden and Audioslave, two fantastic bands I suggest you check out. His wife is suing the physician that prescribed him something like 940 dosages of Ativan over a period, I think, of about a year and a half. And that made quite a bit of headlines, and you just see it more and more in the media. As a pain physician, I see a lot of patients that show up at my doorstep on this medication as well, and they have difficulty getting off of it or they're very dependent on them. And when I talk to these patients and I start taking their history about when they started it, why they're taking it, what I found is that in quite a few of the circumstances that they are often taking it inappropriately for the wrong reasons. For example, some of them might be taking it only because they fear the withdrawal symptoms of coming off of the medication. Others, they might be taking it because they went through something very traumatic, say their cat died or something like that. And my first response is, well, it's just a cat, why are you so upset? And I'm joking, I'm a dog person, I'm not a cat person, but cats are great. I love the memes about cats, and it's just not something that I'm about. And anyway, I probably just lost some viewers there, but moving along, I'm digressing here. So what ends up happening is that they go through something traumatic. A doctor will put them on, say, Xanax or something like that. They end up taking it and there's no end in sight. I'll ask the patient, well, why are you taking it? They tell me, well, I went through this very traumatic circumstance at this point in time. I'm like, oh, well, when did that occur? And, sometimes they'll say, oh, well, it happened like a decade ago, 10 years ago. And, don't get me wrong. I mean, everyone will go through hardship in life and find things very challenging to deal with. And, getting a little help is fine. But at some point, you have to go through the grieving process and come out the other end. And I'm not so sure that taking a medication that's essentially a tranquilizer, like benzodiazepines, for the rest of your life is necessarily the best thing for you. And a lot of these circumstances, I find that the medication is causing the patient more harm than good. And all of this is especially a big deal to me as a pain physician because when patients refer to me, obviously it's for chronic pain or some type of pain issue. And when you mix benzodiazepines with opiates, the risk of overdose and death actually go up by almost tenfold. So to put it simply, benzodiazepines increases the effectiveness of a neurotransmitter or a chemical inside of your brain called GABA, and it makes changes to the receptor. Ultimately, after the cascade of events, what ends up happening is that it tones down your central nervous system at the brain level. As far as the history of benzodiazepines, they became known to the world back in the 1960s, and it was about 1963 that Valium, the more commonly prescribed one that we see today, entered the market. By the 1970s, this class of medications was actually one of the most heavily prescribed medications by physicians. And then in the 1980s is when this wonder drug basically seemed not so wonderful anymore, and we started noticing the addiction as well as the overdose deaths. This medication originally started off as what people deemed sort of a wonder drug because it was a nice alternative to barbiturates, and barbiturates are very sedating, and they both kind of treat the same thing. And so it was deemed something that, seemed to work very quickly and had high effectiveness as well. However, as with a lot of these situations, much like the opiate epidemic, over time we started learning more and more about the long-term consequences of these medications. So in a perfect world, this class of medications would be taken mainly for things like seizures, insomnia, anxiety or panic attacks, as well as to help treat the side effects of alcohol withdrawal. And it's also highly effective for something called catatonia, which is a neuropsychiatric behavior syndrome. And what ends up happening is that the patients develop movement disorders and behavior disorders. This is typically seen in patients that have schizophrenia or other mood disorder issues. Benzodiazepines also should be taken for the shortest amount of time possible and only on an as-needed basis. And ideally, you wouldn't be on it for any more than a few weeks, and then you would come off of it. And the longer you're on it, the greater the consequences long-term, which we'll touch on here shortly. It's also used sort of as a placeholder or something to help treat a patient's severe anxiety or panic disorders while waiting for another class of medications to kick in, such as a class of medications called SSRIs. Those are medications such as Prozac or Paxil, Lexapro, or Zoloft. We'll start off by basically addressing the overdose deaths and kind of dive into some statistics here. So Americans consume about 3 times more benzodiazepines since the mid-1990s. And just so you know, this is not an issue that is sort of specific to the United States. In the Canadian Family Physician Study, they looked at various statistics and found that in Belgium, about 1/3 of people were on benzodiazepines. And in Europe, about 10% of people are taking one of these medications in this class. Of the 948 physicians that they did the survey on, what was alarming was that nearly half, or 46% of them, saw no worries with how they were prescribing benzodiazepine. But getting back to the statistics, the benzodiazepine class medication is involved in nearly 1/3 of all prescription drug overdoses. And in those situations, when these individuals are found to have overdose with benzodiazepines in their system, 85% of the time opiates are there as well. They kind of go hand in hand. Again, I mentioned earlier about how there's a 10-fold increased risk of respiratory depression. And also benzodiazepines has been shown to decrease pain tolerance, much like tobacco abuse, which if you're interested, please check out my tobacco talk that I gave a while back. That will be linked above here. And 17% of people on opiates take benzodiazepines. And from 1963 to 2013, the death rates related to benzodiazepine actually increased 500%. And this is really alarming. 1 out of 10 elderly patients are on benzodiazepines. And we'll talk about more on this topic here shortly. So the majority of people on benzodiazepines eventually will develop a tolerance to the medication. They'll need a higher dosage of it or increased frequency. And as they go up, it eventually stops to work for them. However, by that point, when you're up to significant dosages and taking it very frequently for a prolonged duration of time, those individuals end up becoming very, very physically as well as sort of mentally dependent on the medication. And in a lot of cases, they end up continuing on it because they find that the withdrawal symptoms are just so severe. In situations where the withdrawal is not that bad, they may develop things like tremors or a little bit of confusion. They may have crampy abdominal pain, diarrhea, joint pain, flu-like symptoms. They may develop headaches, they can get insomnia, their anxiety can be a lot worse. Actually, it can be so bad, it's a well-known phenomenon that you can get rebound anxiety as well as rebound insomnia. A lot of people start off taking the medication to treat those, but what they find is that during this time when they're trying to come off the medication, their insomnia and their anxiety that they originally started off taking the medication to treat actually is much, much worse than it was before. I always use the analogy that it's like a Band-Aid, and when that Band-Aid falls off, not only is the original wound still there, it's actually worse, and you actually might have other areas that you need to deal with. And in the worst case scenario, you can develop psychoses, you can have hallucinations as well as seizures, and some people have actually died from these withdrawal effects as well. So it's a medication that essentially is easy to start, but it's very, very hard to get off ultimately. And in some circumstances, it can take well over a year of slowly titrating down on the medication to get off of it. The most common way to try to wean down on it is to decrease it by 10 to 25% at most weekly or every other week. But this is not a medication that anyone should be stopping cold turkey without consulting your clinician first. It can be deadly for you. And lastly, we'll talk about the day-to-day impact of the medications on your brain. And this is especially true the older you are, especially for elderly folks. In fact, there was a National Health Statistics report in January of 2020 that was published where they did the study between 2014 to 2016, and they ended up finding that 27 out of 100 annual visits to a physician, benzodiazepines were prescribed. And as your age went up, this actually increased in incidence. So if you were between the ages of 18 to 44, about 13 out of 100 visits, a benzodiazepine was prescribed. And if you were between the ages of 45 to 64, it was 33 out of 100. And if you're greater than the age of 65, it was found that 51 out of 100, over half of the visits, annual visits to a clinician, a benzodiazepine was prescribed. So why is this so important to talk about? It's really important to talk about when our elderly patients are most likely to get treated with benzodiazepines because of the fact that they are at greatest risk of falls and breaking a hip or developing a subdural hematoma, which is a bleed within your brain that can be deadly. I can't even tell you how many times I have seen a very, very healthy and fit elderly person fall, break a hip, and their body and their mind just starts to fall apart thereafter. It is a population of patients that is at very high risk once they are started on these medications. And the other thing to keep in mind is that as we get older, it's the elderly population, especially greater than the age of 65, where dementia and Alzheimer's really starts to play a role. And if you're interested to know more about Alzheimer's, I actually did a video a while back that I'll link above to talk about the latest research on Alzheimer's and how they found CBD can actually affect that. So there was a Alzheimer's study, and they found that people that took benzodiazepines for 3 to 6 months in a row had a 32% greater risk of Alzheimer's as they got older. And if you took it for more than 6 months, the risk went up to 84% or greater. And there are numerous other studies that have shown this correlation as well. So to wrap things up, I just want to reiterate a few key points here. One of them is that, again, as a reminder, this is not a medication you should stop abruptly. This is something that you should not quit cold turkey. It's something that you should talk to your physician about and work with them to come up with a regimen and a plan to slowly wean down on this medication because of the horrible withdrawal side effects and the complications that can occur. So if you're someone who has taken this medication and think about quitting, that would be my suggestion. However, if you're someone who is watching this video and you know of someone, you have a loved one or a very close friend that is taking this medication and you want to talk to them about coming off of it, the one thing I would suggest is do not judge them. Some of the stereotypes that I hear about people that take, various medications is that, oh, they're just, mentally weak. That's why they're on these medications. That's really not the case. I've seen some of the most mentally tough individuals show up and life just happens, right? And they kind of get kicked while they're down in life, and a series of tragic events all happen at one time. And you can give me the most mentally tough person. It's very, very difficult for anyone to cope with a series of very tragic events all kind of happening at a time when you're most vulnerable. And so they get a little bit of pharmacologic help, say in the form of a benzodiazepine, and they take it, but then they end up getting stuck on it for all of the reasons that I talked about before. So in situations like this, what they need is encouragement and support and not judgment. And please know that I do feel that benzodiazepines do have a place in medicine. They have benefited a lot of patients in very big ways. And so if written responsibly and taken responsibly, however, I do feel that it warrants a deeper appreciation for the dangers of the medication as well as why we take it and how we take it. And it warrants a deeper discussion between the clinician as well as the patient before the medication is ever started upon. So I will close here. Please feel free to comment down below if you have had any experiences with this class of medications yourself. You never know how your story could really benefit somebody else. And so with that, I'll see you next time. Till then, take care, stay safe. Bye-bye. Pura Vida.